Good morning, everybody, and thank you for joining us today for Webinar Wednesdays with SMP. Our May hot topic has been ambulance services and fraud, so that's going to be our topic for today. My name is Sunny Lawless, and I'm the volunteer coordinator for our SMP programs. And joining me this morning is Danielle Guillory and Johnetta Red. They're both our community outreach specialists in Mississippi. We will take questions at the end of our presentations today. There's also going to be a prize drawing for those of you who registered for this webinar prior to 10:15 this morning, and our winner must be present to win. This project was supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services in Washington. Grantees undertaking projects under government sponsorship are encouraged to express freely their findings and conclusions. Points of view or opinions do not therefore necessarily represent official administration for community living policy. Who is Senior Medicare Patrol? Well, Senior Medicare Patrol, or SMPs, are grant-funded projects by the Administration for Community Living. Every state has an SMP program. In Georgia, Louisiana, and Mississippi, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Before I turn things over to Danielle for more information on ambulance services and fraud, we do have a quick polling question for you all. So let me get that launched. And today's question is, have you ever used ambulance services or called an ambulance for someone else? So just a quick yes or no. And we'll give everyone just a moment to vote, and then we'll look at the results. Just a few more seconds. Have you ever used an ambulance service or called an ambulance for someone else? All right, I'm going to close the poll. And it looks like 83% of you have used ambulance services or called them for someone before. So today we're going to talk about what criteria has to be met in order for ambulance services to be covered by Medicare. So I'm going to turn things over to Danielle, who's going to give us that information.
Good morning, everyone. As Sunny said, I'm Danielle Guillory. I'm the Mississippi Outreach Community Specialist. And what we're going to be talking about today is the criteria for ambulance services and ambulance fraud. Medicare covers both ground and air ambulance transportation when all of the following criteria are met. Transportation is deemed medically necessary. Traveling in a wheelchair, a van, or car would put the patient at risk. It is the only means of transporting the patient safely, and regardless of destination type or reason for transport, the need for a stretcher in an ambulance must be required and proven. Next slide. The ambulance is required to have a stretcher, medical supplies, oxygen equipment, lights and sirens, and telecommunication equipment. The beneficiary must be transported to the closest facility that can treat their condition. And an example of that would be taking the beneficiary to the nearest hospital or skilled nursing facility, or transporting the patient with end-stage renal disease to and from a dialysis center. Now, non-emergent and ambulance transportation coverage is different. Ambulance services may be covered by Medicare for non-emergent transportation, such as physician visits, lab, or x-ray facilities, or other medically necessary transportation if the patient is confined to a bed and cannot be safely transported except in an ambulance, or if they are not confined to a bed but their medical condition is such that any other type of transportation would be detrimental to their health. Next slide. A repetitive ambulance service is defined as a medically necessary ambulance transportation that is furnished 3 or more times during a 10-day period, or at least once per week for at least 3 weeks. Repetitive ambulance services are often needed by beneficiaries receiving dialysis or cancer treatments. The following criteria must be met. The beneficiary still needs to meet the medical necessity requirements, and the ambulance supplier must have a physician's written order that certifies that the beneficiary meets these requirements. Next slide. Ambulance services that are not covered by Medicare are as follows: if the patient can walk, or if they can be transported in a wheelchair and safely ride in a car, taxi, or wheelchair van. Next slide. So now let's talk about ambulance fraud. Medicare has very specific criteria for ambulance services, as we've discussed. Ambulance fraud happens when Medicare is billed for transportation services for patients that do not meet the criteria. And next, we're going to take a look at some of the common types of ambulance fraud. Next slide. One of the common types of fraud is falsely billing for services that were not provided. And an example of that would be when an ambulance company falsely bills Medicare for a trip that did not happen, or billing Medicare for supplies, procedures, or medications that were not performed or used during a trip. And an example of that would be billing for oxygen that was not given to the patient. Next slide. Another common example is billing for unnecessary services. Some examples of that would be falsifying documentation to show that a patient met the Medicare guidelines for the use of an ambulance when they actually did not, or a physician signing a medical necessity document for a patient to be transported home by an ambulance when they could have been taken home by car by a family member. Next. Another example of is overcharging for services. And some examples of overcharging include upcoding or overbilling for an ambulance service to elevate the reimbursement from Medicare, billing for medically unnecessary ambulance transportation when the patient could have gone by car or van, billing for more miles than were actually traveled, or billing the patient instead of Medicare, even though the provider participates in the Medicare program and the transportation met the Medicare criteria. Next. Our last example involves kickback schemes. This one involves schemes between the ambulance service and the hospital. This is where an ambulance service agrees to transport low or non-profit trips in exchange for the hospital exclusively using their service for their emergency or paying trips. Next. There are several things that you can do to stop ambulance fraud. Be sure to always review your Medicare summary notice or your explanation of benefits if you have the Medicare Advantage plan. Be sure that the services you were billed for match what you received, and check to make sure they did not overbill for the mileage. Make sure you were not billed for an emergency trip if it was not an emergency, and always look out for upcoding. Next. Now that we've gone over ambulance services and fraud, Johnetta is going to share the 3 keys to the success in stopping healthcare fraud, waste, and abuse.
Thank you, Danielle. The first key is protect. Protecting your personal information is your best defense against healthcare fraud and abuse. We ask that you treat your Medicare and your Social Security number like your credit cards. Never ever give these numbers to a stranger. Remember, Medicare won't call to ask for your Medicare number. Don't carry your Medicare card unless it's needed for your doctor's appointment. As we mentioned in previous slides, it helps to keep a record of your medical visits, your medical tests, and any type of procedures in some type of a healthcare journal, or keep it on your calendar. Next slide. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare summary notice or explanation of benefits from your insurance company. Your Medicare summary notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive healthcare services. Compare your statements to your personal records and look for the following items. Look for charges for something you didn't get, billing for same services or supplies twice, services that weren't ordered by your doctor. The next slide. The third and final key is report. If you suspect you've been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to Senior Medicare Patrol. If you have questions about your Medicare statement, call your healthcare provider or your healthcare plan. If you are not comfortable calling your provider or not satisfied with their response, call Senior Medicare Patrol. Next slide. So now you may be wondering how you can help and become involved. Senior Medicare Patrol is always looking for civic-minded individuals to join our fight against Medicare fraud. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-weekly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. If you think volunteering for Senior Medicare Patrol is something you might be interested in, give us a call at our toll-free number, 877-272-8720, and we would be more than happy to send you one of our volunteer information packets and answer any questions you may have about the process. Next slide. As mentioned in previous slides, we have a toll-free number. You can also visit our website, www.stopmedicarefraud.org, for additional information about our program. And we would like to encourage you to like us on our Facebook page. Next slide.
All right. Well, thank you, Danielle and Johnetta, for that information. We do want to remind everyone to save the date for our next Webinar Wednesdays event on June 29th at 10:30 a.m. We're going to meet to talk about volunteering for SMP. So we really hope that you'll join us then. And we also want to invite you all to join us the week of June 6th through June 10th as we celebrate 25 years of the SMP program and also National Medicare Fraud Prevention Week. Throughout the week, we're going to be hosting daily contests on our Facebook pages. So you want to make sure that you followed our pages on Facebook. We're also going to have a special virtual bingo game on Friday, June 10th at 10:30 a.m. I will include the registration link in my follow-up email to you all today. So hopefully, if you're available, you'll join us. We're planning to have a great celebration that day. We'll be giving out prizes throughout the games in addition to just our normal bingo prizes if you've played with us before. So we really hope that you'll save the date and join us then. Before we wrap up, we're going to go ahead and do that prize drawing for those of you who joined us today. If you registered for the webinar prior to the start time, your name has been entered into this prize drawing. So give me just one moment and let me pull up the wheel. And here we go. So we will go ahead and spin, and you do have to be present to win. So we'll look at, make sure, and then if this person isn't logged on, we'll spin it again. All right, Miss Laphilia Johnson, congratulations. You're our prize drawing winner for today. And I do see that Miss Laphilia is on. So I will be reaching out to you later just to get some information so we can get that prize out to you. All right. Well, before we wrap up today's presentation, we want to open the floor to questions. So if you have a question regarding any of the information that we presented today, please raise your hand and we'll unmute your line and you can ask your question. If you look to the right of your screen, you'll see a control panel that looks similar to the one that's on the screen. There's a hand button, and if you just click on that, it will raise your hand and I'll unmute your line and you can ask away. I'll just give you just a few moments to think about if you have any questions. Okay, well, I'm not seeing any questions, hands raised actually. So this will conclude our presentation on ambulance services and Medicare coverage and fraud. We will send an email after the webinar today with a link to a short survey. I also put it in the chat box. If you saw it, you're able to click on it and go ahead and answer that survey for us now. We would really appreciate it if you would just take a few moments to do that survey and let the Administration for Community Living know how we did today. We really appreciate you all joining us, and hopefully we will see you in a couple of weeks to help us celebrate our 25th anniversary and Medicare Fraud Prevention Week, and save the date for our next webinar on June 29th. All right, well, everyone have a great week. We appreciate you joining us. Take care, and we will see you next time. And thank you to Danielle and Johnetta.